There is a new escalation pathway for outpatient areas. This is the news, triggers and clinical response escalation pathway that will be used in Ipswich and Colchester Hospital's outpatient departments. This has been designed as a guide for staff to help with the management of a deteriorating patient within their area. If you have a patient or relative that collapses within your area or becomes acutely unwell, first please assess whether this is a peri or cardiac arrest. If it is, please call 2222. For those patients that do not need 2222 but still need further assessment, then follow this chart. Your first step will be to assess your patient and establish a News 2 score. The News score will guide your next steps. It will tell you who to call and how often to do observations. This chart has been divided into 4 sections dependent on the News score. We will go through each section on the following slides. If your patient has a News score of 0, assess the patient, decide whether you need to increase the frequency of monitoring. If they've had chemotherapy in the last 6 weeks, they'll be at an increased risk of sepsis, and if they have become unwell whilst with you, then consider screening for sepsis. If the patient reports that they feel unwell, their relative is concerned that they are not quite right, or your clinical intuition tells you that they are unwell, then please do not hesitate to escalate to your local clinician despite the low News score. If the News 2 score is between 1 and 4, observations are done 4 to 6 hourly. The area coordinator is informed and they will assess the patient and decide if they need to increase the frequency of monitoring or if they need to escalate. A sepsis screen can be considered. Patients that have a News score of 5 to 6 or 3 in one single parameter, the observation frequency needs to be a minimum of 30 minutes. The area coordinator needs to be informed of the News score, and the RN or the AHP needs to assess the patient and immediately inform the local senior clinician, and they need to review the patient within 30 minutes. If this local senior clinician is unavailable, then contact the on-call medical registrar via their bleep. This review also needs to occur within 30 minutes. Critical care outreach team are available as a second responder if the medical registrar deems this as appropriate. Following the doctor review, if further assessment or treatment is required, then there are 2 options. If the patient is stable, then they should be safely transferred to the acute admissions ward. If the patient is unstable and requires emergency intervention, then they should be safely escorted to the emergency department. In both of these cases, the receiving area needs to be informed prior to the transfer. Patients that have a News score of 7 or more, then their observation frequency will be a minimum of 15 minutes, and they should also be continuously monitored. This means that they have their machine with them that takes their observations. They should have the saturation probe attached, the blood pressure cuff attached, and they should have a member of staff with them at all times. Once this News score is taken, the area coordinator needs to be informed immediately. The RN or the AHP has to come and assess the patient, and then they immediately inform the local senior clinician for immediate review. If you do not have a senior clinician within the department at that time, then you should call the medical registrar via their bleep. They will need to come and review the patient immediately. The critical care outreach team will come as a second responder if the medical registrar deems this as appropriate. Following the senior doctor review, if further assessment or treatment is needed, there are 2 options. If the patient is stable, they will have a safe transfer to an acute admissions ward, so SAU or EAU. If the patient is unstable and they require emergency intervention, then they should have a safe escorted transfer to the emergency department. In both of these cases, please inform the receiving area prior to transfer. Please complete a sepsis screen for these patients and commence a fluid balance chart. At the bottom of the escalation pathway, there are contact details for your use. So this will be the coordinators of the escalating areas, the EAU and the SAU coordinators numbers plus the medical registrar bleep number. All outpatient areas should have these charts laminated and attached to their observation machines so that staff can use them as reference. When your patient deteriorates whilst with you, don't forget to complete an A to E assessment of your patient. Treat life-threatening things first, such as if they are hypoxic, please make sure you put oxygen on them, and use an S-bar handover when escalating to your doctors or any other teams. Thank you for watching. Any other questions, then contact your line manager or the deteriorating patient team.